Dry skin is something none of us are immune to, but for some, dry skin can take the form of eczema-prone skin, which can have severe impacts on someone's physical and emotional well-being. We've teamed up with leading dermocosmetic brand Avène and respected South African dermatologist Dr. Nivana Ramlachan to help shed some light on the skin condition and how to manage it. Well, doctor, a lot of South Africans struggle with eczema-prone skin. Can you tell us more about the condition and what causes it?
So atopic dermatitis is a chronic relapsing dermatitis that affects a large proportion of our patients. It's a common presentation in dermatology, and patient presents with pruritus as well as the skin rashes. This condition has a genetic predisposition as well as there's interaction with environmental factors. When we have patients with atopic dermatitis, there is disruption in this wall. Viruses, bacteria, all of the pathogens are then able to penetrate through the epidermis and then cause an inflammatory reaction. Once you understand that there is disruption in the skin barrier, your primary would be to repair the barrier. So the doctor must give you advice, your dermatologist or your general practitioner must give you advice as to how to repair this barrier. Majority of patients with atopic dermatitis will be controlled with just topical treatments.
We know that many people suffer from eczema-prone skin, including children. What advice do you have for parents of children suffering from the condition?
Atopic dermatitis is an extremely stressful condition for both the child as well as the parent. One of the things for parents to understand is, I think I see a lot of guilt in parents who come in, and it's to understand that this condition has a genetic basis, so it's nothing wrong that they're doing.
Doc, are there any stimulants that work to aggravate eczema-prone skin, thereby making the symptoms worse?
Strong detergents, frequent washing, all of these will impact on skin barrier. Places where there's low humidity, like up here in Pretoria, often in the winter there's dryness, so there is water loss from their body to the environment, which then further aggravates the conditions.
A skin condition that can cause havoc, impeding on one's ability to live a healthy and carefree life. But now that we know what causes eczema-prone skin, and indeed what makes it worse, it's time to act. But with so many products and so-called solutions out there, how do we navigate? How do we separate fact from fiction? Well, I think it's time that we get some answers from the experts.
Talking about emollients, I think it's important to understand that the primary aim is to repair the barrier. We then need to understand, is it mild, moderate or severe disease we're talking about? Because that will then affect the choice of emollient.
So what makes Avène distinct from other options in the skincare category?
So there are a wide variety of emollients on the market that we would say are good. However, when looking at the Avène range, it's an emollient that helps to repair barrier. What makes it unique is that all of their products contain their thermal water. So me as a scientist, before I will prescribe water to my patient, I want to know the science behind it. And I think this is important. We now understand that in addition to this physical barrier of the skin, we have a microbial barrier. Having product like this Aqua Delamere tends now to have some impact in now trying to get this balance of good and bad bacteria.
The Avène Zerocalm AD range is specifically formulated to help manage the side effects of eczema-prone skin. When it comes to products like the Avène Zerocalm AD range, what makes it particularly potent when it comes to soothing eczema-prone skin?
So this is one of the products that I use when treating atopic dermatitis. These products are fragrance and preservative free, and they help to repair skin barrier.
When using something like the Zerocalm AD range from Avène, how best does one apply?
So we talk about fingertip units in dermatology. So one fingertip unit on the face, and on the arms I would use two to three fingertip units. I think regular application, so I advise at least twice a day application of product to my patient's skin, as well as it's best to apply emollients after a bath. However, the patient, if you're applying twice a day, you do not need to take a bath twice a day, because I think that is also frequent washing is not what we want in patients with atopic dermatitis. And I think it's important to understand what this disease is, to understand how we want to repair barrier, and that the quicker one is able to get a correct diagnosis and seek right treatment, we can get very good control for patients.
My time with Dr. Ramlachan has been so eye-opening and an encouraging one too. It's really good to know that those living with eczema-prone skin have the answers they so desperately need. It's time to say goodbye to the itch and discomfort and hello to soothed, nourished and replenished skin.